The Prime Minister has set out how he plans to transform the National Health Service in England over the next decade. Care will be shifted closer to people's homes to reduce the reliance on hospitals and A&E. An enhanced NHS app will give patients more control over their care, and there will be multi-purpose treatment hubs to help with a range of medical issues. Our health editor, Hugh Pym, reports.
Scissors in a moment.
This is complex and expensive treatment. But staying healthy doesn't have to be. Now the government wants local health initiatives as well as national solutions. It's called a neighbourhood health service, and this is what it already looks like in Whitstable in Kent.
What clinics have you got going on this afternoon?
Dr John Ribchester has designed a GP surgery with a difference.
Sharp scratch.
It runs steroid injection clinics, there's an operating theatre and an urgent treatment centre. Marilyn tripped over, and she realised she could come here instead of a likely long wait in the local A&E. Within the hour, Marilyn hears her foot is not broken and she can go home. In the operating theatre, they can do simpler hand and wrist surgery, cutting waiting times and taking pressure off local hospitals. But the big question is, can this be replicated elsewhere? The GP who started it has his doubts.
General practitioners are funded in a way that supports general medical services, general practice, but when it comes to providing the estate, including operating theatres and an X-ray department and all the special rooms necessary for this, we're very much on our own.
The shift to local health networks can be tailored to each neighbourhood. The solutions in East London are very different to Whitstable's.
That lady's made a hat as well over there.
In Bromley by Bow, GPs work closely with the community centre to help build trust and bring people attending classes like sewing and dancing into earlier contact with health services, improving their outcomes. But even here, there are sceptics.
My understanding of this policy is that it comes with very limited money. So absolutely this is a good idea, but we do need some funding in order to back this up and make it happen in reality.
So where's the money coming from? The Health Secretary told me it is there.
It is through the combination of the public investment outlined by the Chancellor in the budget and the spending review, but also the government's infrastructure plan. We are going to test the market and look at opportunities for private investment.
But your investment budget is flat at the Department of Health, isn't it?
Well, it's the biggest capital investment we've ever had. We've got ring-fence funding for technology as well.
And part of the plan will be the expansion of the NHS app to give patients and doctors better access to health records, what's billed as a doctor in their pockets, with advice and appointment bookings. But for those struggling to get treatment now, there'll be no overnight solutions. Hugh Pym, BBC News.